Ankle problems fall into three different specific groups. Ankle instability is a common issue and is a problem whereby people feel that their ankle gives way on them. This is the typical sprain and is a very common thing in the general community. The second group of disorders includes pain, which may be associated with the instability. The third group of disorders is ankle stiffness, which usually follows an injury. And there is another subgroup of disability, which may or may not relate to the ankle at all. Sometimes people also develop deformity, which may or may not be painless. Ankle instability usually follows an acute episode. Most people with a little care can recall the day that they first turned their ankle whilst often playing a sport. Often this is not remembered, as the people have become so used to the instability that they regard it as part of their normal life. It is, however, a functional issue and can affect your ability to work or to play sport. Generally, ankle instability does not resolve, and I'll explain this in a second. To answer the question as to why ankle instability does not resolve, one has to understand why your ankle is unstable in the first place. When you have an injury to your ankle, you are generally speaking tearing ligaments away from the bone. The ligaments are designed to restrain the joint, and they pass from one part of the joint to another. With a significant ankle sprain, the ligament is generally torn away from the bone. It has very limited healing potential, and generally therefore you are left with a functional gap between the bone and the ligament that should be attached to the bone. It is not until surgical correction is undertaken, bringing that ligament, which is fairly normal, back into its normal position, that your ankle will be stable again. This does not mean that everybody needs an ankle reconstruction, as many people manage to some degree, particularly if their requirements are not high. However, if you are a sporting individual, and particularly if you're young, you will find that your unstable ankle will not completely return to normal, and you may find yourself relying upon a brace or taping. Reconstructive surgery is largely successful, and as I've already explained, is a simple process. This diagram demonstrates the position of the main stabilizing ligament of the ankle, which is called the ATFL. It passes from the end of the fibula into a small bone called the talus, which is the main bone of the ankle joint. It is supplemented by another ligament below it called the CFL. Usually, we perform an arthroscopy at the same time as we perform an ankle reconstruction. The reason for this is that at some time, often as the acute injury is taking place, the ankle itself is also injured. This can involve damage to the joint surface of the ankle and may also involve the production of loose bodies or other specific anatomical problems. Ankle surgery is generally done as a day procedure. If you are simply having an ankle arthroscopic procedure, that is to look into the ankle at the front or the back, we will send you home on the same day, and we will not ask you to be immobilized. Rather, we'll show you a series of exercises, and we'll ask you to do these exercises on a regular basis. We'll also organise for you to see a physiotherapist. You will need crutches for ankle surgery, and generally speaking this will be for about a week. If you've been put into plaster or into a boot or slab, it may be because you've had other surgery such as a reconstruction. We immobilise people with reconstructive surgery for about a week, and the reason for this is to allow the wound to heal and for the swelling to go down. Usually there is very little pain with ankle surgery. We aim to deal with all of your issues in one surgical procedure, and this may involve the reconstruction itself, arthroscopy of the ankle, and perhaps even decompression of other joints in the back of the ankle. We will see you about 10 days after the surgery, and we will ask you to rest after the surgery. Rest means rest, and this means that you need to stay home and elevate your foot, moving it regularly. You will need crutches. You will also need to consider help with your home and maybe and maybe time away from work. Driving may not be possible, particularly if you've had surgery on the right lower limb. Return to normal activity after an ankle arthroscopy would involve water-based therapy, usually between 2 and 4 weeks, and then perhaps resumption of sport at 6 weeks. Depending very much on the type of problem that you've had, it could extend further than this, up to about 3 months. The longer-term results are very much determined by the findings at surgery. Ankle stiffness. Ankle stiffness is common after an injury. Many people have had a significant ankle injury and find that despite physiotherapy and the like, they are simply not improving. With retrospect, many people can regard the improvement to have stopped at about the 3rd week, and they will say to you that they noticed that the stiffness in their ankle did not resolve from that time forward. If you've had a serious injury, you might find yourself seeing me between 3 and 4 weeks after your original injury, perhaps even sooner. We would recommend that you continue with your physiotherapy until the point has been reached whereby you no longer improve further. A good physiotherapist can make a big difference to your treatment, but if your physiotherapist is unable to offer you a progression of your treatment, then you may need to have surgical treatment. Treatment apart from surgery involves physical therapy, injections which are used in a selected fashion, and maybe arthroscopic decompression. Arthroscopic decompression of the ankle involves removal of scar tissue which forms in the ankle joint. It may also involve releasing the ankle joint from the back, as this is where some of the greatest stiffness lies, and perhaps also another joint called the subtalar joint.